Great. All right, good afternoon, everybody. Welcome. We've got a fantastic session this afternoon. We're going to be talking about defining your organization's path in analytics. We have a lot of folks registered for the session this afternoon, so we're going to give everybody a few moments to log on. Welcome. I'm Jen Kovich-Bordenick in Washington, D.C. with my partner in crime here, Emma Valinsky-Lloyd, who's on the, what do we say?
Director of Programs.
Yes, Director of Programs. Thank you. So basically running the operations here. So great. So welcome everybody. We are thinking of our friends and family in Florida right now. So if you are in Florida or have friends and family there, again, I think we're all thinking of them down there. It looks like it was a bad night. So sending them our best thoughts and prayers. Again, I'm here outside of Washington, D.C., and we've got two really impressive folks with us today. Melanie Craff, who's the VP of Strategic Analytics and Education at Milliman MedInsight, and Will Fox, who's the Chief Actuary at Milliman MedInsight. Melody, Will, why don't you tell us where you guys are logging in from? Where are you in the country today?
Okay, I happen to be just outside Seattle. So in the glorious forest near the mountains. So I'm not a city dweller.
Okay.
Well, how about you?
Pacific Coast. Will, where are you?
Also in Seattle. I'm actually down in our office. I can see the Space Needle, and we're always happy in Seattle when we get a little extra summer here. It's still 70s and look good this weekend.
Excellent. Well, we would love for folks out there in the audience to tell us where you are. Emma, do they have the ability to go in the chat room and tell us where they are?
That is a great question, but I can't ask them. Now, I will just stop sharing really quick and I will double check to ensure that that is the case. All right.
There we go. So we'd love to see if some other folks are out in the Pacific Northwest today in Washington State, or if any folks are in Florida, let us know how you're doing, or Georgia or South Carolina. Again, it's been a crazy 48 hours with Ian, unfortunately. So welcome. We see Yvonne in Reading, Pennsylvania, Madison, Wisconsin, in Florida. Oh, good, Scott. Hope you're doing okay there. Glad to see somebody from Florida here. Some more West Coasters, California, fantastic. Annapolis, Maine, fantastic. State of Confusion. I don't know where that is, but sounds familiar. Welcome. Indiana, Quebec. All right. We've got some of our global participants here today. Fantastic. It's great to have you here. Vermont, Baltimore. Anybody from Washington State? Anybody representing Will and Melody today? Be great to see some more folks from Washington State. Tell us where you're logging in from today. Tell us if you are in Florida or in the pathway of the storm, or if you survived. Again, there you go, Todd Fessler. Okay. Welcome. Great, Todd. Great to have you. Hawaii, welcome. This is, I have to tell you, this is a really popular topic, and we've had so much interest in this webinar today. So I'm glad that we're finally able to bring this to you. This has been a long awaited topic. So looking forward to that today. We have, again, a lot of people logging on. So I'm going to just give it one more minute before I dive in. Great. More Seattle folks here. Welcome. Great to see you here today. And then I'm going to just dive into some introductory points, and then we will switch over right away to getting into the meat of this with the analytics piece. Great examples here, and again, really a stellar crew to present today. So welcome to both of you. And why don't we go ahead and just go through some of the housekeeping stuff, Emma, while we're waiting for more folks to log on. Again, I want to make sure nobody misses the important stuff here today. So just quick housekeeping. There is a recording that's being made right now, and we do have the slides. You're going to want the slides. They're very good. And that will be going out to everybody later today. So you can share that if you know somebody who's missed the presentation today, but you think would be interested in that. If you have questions, and we know there are going to be a lot of questions today, there is a Q&A box there in the bottom. Please go ahead and put them in the Q&A box. We welcome all comments throughout. So as you hear Melody and Will talking today, if you have thoughts, questions, if you have the same things going on in your organization, or just, real curious, please let us know. Feel free to stick those in the chat box, or if you have a specific question, put that in the Q&A. And we will go ahead and get to that near the end of the presentations today. Next slide. So for those of you who are not familiar with EHI, Executives for Health Innovation, we are a fantastic nonprofit organization here outside of Washington, D.C., really a catalyst for healthcare transformation. And we pride ourselves on being able to convene all kinds of diverse leaders from across the spectrum of healthcare and technology. And we do three things really well. Collaborative learning, which means these webinars, executive roundtables, really bringing together multi-stakeholders from across the spectrum. We are particularly good at shaping policy. So all of our learning and education and bringing together and convening of leaders allows us an opportunity to share all of those insights with folks on Capitol Hill. They really are looking for kind of a strong, neutral, multi-stakeholder opinion and perspective, and we're able to offer that. So we have a big role in shaping policy. And then finally, really wonderful thought leadership. So what we're doing today, we've got a number of reports that we release. EHI is really for folks who want to do more than network. We're really a convener of folks who want to change things. So we bring together all of these influential leaders in different forums to really talk about what needs to get done and then get it done. And we've done a tremendous amount of work over the last 20 years, and I don't have time to go through all of this, although I'm sure you would love for me to. But we've been doing a lot of work on analytics and data since 2000 when we first started. Everything from, the early adoption of EHR records and e-prescribing to now where we are, which is really promoting digital innovation and understanding the patient experience and really figuring out how to use data to specifically target patients' individual needs. We've got 4 focus areas. We look at patient experience, digital care, health equity and access, and as everybody's really interested right now, privacy and cybersecurity. We want to make sure all of that data is safe as well. This is just a sampling of some of the folks that are engaged in our organization. If you do not see the name of your organization up there, it needs to be up there. So feel free to reach out to myself or Emma through the chat box. We'd love to get you involved in our work, and we will see if we can do that. And as I mentioned, we've done a lot of reports recently that are somewhat related to what we're talking about today. There's a great report in there about protecting health data, how to create a modern public health system with data and analytics, usability, optimization, really great how to connect healthcare data, what lies ahead in terms of technology. And we encourage you to go ahead and download these. I think Emma's sticking those in the chat box right now. So yep. If you're interested in any of those, please feel free. And then finally, I want a big thank you to Milliman MedInsight today. As I mentioned, we're a very small nonprofit. We would not be able to bring together such incredible speakers and bring such, powerful and meaningful programs to you without the tremendous support and of organizations like Milliman. So I really want to thank them for their support today. And without further ado, I'm going to turn it over to Melody and Will, who've got a really stellar presentation to bring to you today. As I mentioned, if you have questions or comments, go ahead and stick those in the chat as we go through, and we will get to them at the end of the presentation. Take it away, Melody.
Okay, I hope everyone can see this screen. Let me know if that's not the case.
All good.
Oh, good. All right. Well, thank you so much, EHI, for having us here today and for all of you for attending. So we hope to share a few thoughts with you and inspire some dialogue on this topic. So we really felt that it's a pathway, and that is the title of our presentation. So is your organization's path in analytics, and specifically creating an analytics center of excellence. So here we are again. So I'm Melody. I've been more than 25 years in the healthcare business. You can tell from my accent accent. I can't hide it. I grew up in England. My medical degree is actually from the University of Cambridge, and then moved over to the US for Boston, Harvard, and Yale, and so on, and came through the healthcare system and group purchasing. So seen a lot of the different facets of the healthcare ecosystem, and then have been working in really the insurance and claim space, because for me, that's where it all collided. That's where it comes together, and you can see what's happening on the payer and provider and employer and consumer side of things. So that is my passion, and I head up the analytics team over at MedInsight. Will, do you want to go ahead?
Yeah, so Will Fox, I've been at Milliman over 30 years, and it's an amazing ride just being in healthcare. It's always something new and fascinating. Transparency has been a big thing lately. I think all the data and technology changes that are making it easier to get bigger and bigger data and do more cool things with it. So it's super fun for me, being a data geek who loves to dig into the data and go through that. But anyway, hope we get a lot of chat messages and Q&A here today and make this as interactive as possible.
Yeah, superb. And we just thought we'd pop in a link in at the bottom. Will and I wrote up a white paper just a few months ago. So hopefully that would be a great resource for you as we walk through this presentation as well. Okay, so just in background, MedInsight is a technology practice within Milliman. So Milliman is a big global actuarial consulting firm, but MedInsight takes on the technology arm of that in healthcare. And our purpose there is to empower that easy data-driven decision-making. And we're really trying to get at those important healthcare questions. So always contextualize in your business framework and what's important to you today. Will, do you want to walk us through the agenda?
Yeah, so today we're going to talk about, what is an analytics center of excellence? And then how do you evaluate your current state? Where are you at, where you want to go? And then how do you assemble a team? Who all do you need? And putting that together, and then the benefits, and finally the pitfalls and key success factors.
Superb. So I'm going to get us started. And usually the first question that everybody asks is, well, what is an analytics center of excellence? Well, I can tell you that I do not mean a brick and mortar kind of concept. It's much more abstract. It is actually a framework, and it's a framework about data and creating a culture. So I will posit to you all that culture is the crucial thing here. But as we step through this, we're going to talk about people and processes. So as an example of that, I wanted to share with you, this is an example of personalized adaptive care. It comes from a company called Wellframe. So they're in the pharmacy management space, where they were able to connect with their patients and tailor their offerings. They were able to achieve a $2,000 reduction in cost per patient. And it did increase the capacity of their care managers and case managers. Technology is going to be very empowering in this. So my story there is really what we're doing in MedInsight. We look at an independent research group. They're called KLAS, Class Research, and they help us understand what our customers are saying about our organization and others in this space. So this concept of a responsive web portal has been really important to many. And we'll talk about that more as we walk through this webinar. It's about the idea of self-service, right? And the access to data and analytics at your fingertips. It's also the concept of integration, so that a client organization can integrate our information with their own in a data warehouse. And that really enables their own automated reporting and their own analytics. We'll talk a lot about data fluency. McKinsey actually tells us that there is a 12% increase in productivity as we expand the training availability and the data literacy and data fluency. But I really did want to focus in on that training aspect. So you see that in the bottom left. So a funny story about this that I heard actually comes from a little sidetrack. So not in human healthcare, but in veterinary healthcare. And one of the largest owners of veterinary radiology accidentally sent out training to their entire organization. So this is Mars. So Mars is the owner, the primary owner of veterinary practices and veterinary radiology. And they were intending to send training out to just 50, I guess, data geeks like Will and myself, but they accidentally sent out to 140,000 people. Well, the next day, 2,000 had already signed up. So they ran with it, and it thrived. It gave everybody a new comfort level with this world of data and analytics. More and more people participated across all the different functions. And today they recognize $0.5 billion of value, as well as reduce new product improvement times and cycle times. So we're really, thriving success there. Interesting piece on the cross-functional input, you can tailor your outcomes. So example here is actually from Cigna, where they notice that it takes 68 days on average for someone to connect with a behavioral health specialist. And it may take even 5 tries to find the right kind of behavioral health service. So I don't know if you're seeing that in your worlds as well, but we also have found the importance of that outside perspective, just so that you have some objective knowledge sharing. So example of this is the work that we've done actually with UCLA and published in JAMA on COVID disparities. So we all have suffered COVID, but care isn't uniform across the board. And when we look at the patterns in both unavoidable and avoidable emergency care, or preventive care, or access to therapies, or access to behavioral health, we notice significant disparities according to geography and social vulnerability, and also the line of business, whether that's Medicaid, Medicare, or commercial. So those are just a few examples. Why culture is crucial, I come back to that hypothesis. Here are some results. This was a survey that was done of a lot of the Fortune 100, Fortune 500. And so what they found is, despite all the value I just showed you, it isn't that easy to get to that data-driven culture. And what they notice is that very fewer companies than expected took up the mantle here and pushed forward with a data-driven culture. But only 7.5% of executives said that technology was the problem. In fact, generally, it was people and process and organizational alignment and even cultural resistance. So it's those soft skills. And of course, culture is so vital to all of this. So, Will, I need your help here. All right, as we think about challenges along the way, for this little cartoon, I hope this resonates. I certainly seen this. So first person is thinking, saying, gosh, we waste at least $2 million a year arguing about who has the right figures.
Yeah, and then the actuaries jump in and say, oh, my spreadsheet says it's only $1 million. And so even arguing about what they're going to argue about is there is just a lot of waste, and this will come up in other parts of our presentation here today, of like having a well-functioning center of excellence will avoid a lot of the friction that exists and a lot of the time wasted in just arguing about, do we have the right numbers going on here?
Absolutely. So how do we start addressing that? Well, here's a conceptual model for you. So it's based on what MedInsight looks at. But if you read the slide from the bottom up, the very first thing you're going to need is confidence in your data. So have a model where you've got those audit checks built in, and maybe some of them are automated and some of them are manual, but there's a lot to do with that data certification, that rigor around data quality. Once you've got that and you've got that data reliability, you've got to make sure that it's correctly formatted and stored, that is complete data. So all sorts of small things that are very important, removing duplicates, really understanding the nuances of this data so that it becomes ready to use. Then on top of that, now we can get to our technologies and analytic methodologies. That's when a lot of the products come into play, where you can have different looks at your data and it processes it for you pretty swiftly and automatically, so you get the insights you need. And we want that kind of comprehensibility and flexibility in this for an adaptable business intelligence platform. So I hope you're seeing that in your worlds as you're thinking about tackling this problem. But let's think for a moment about the types of analytics that you might be using to inform your business decisions. So I hope a lot of these categories are really familiar, but the difference here is I wanted to give you a few examples. So in descriptive, what happened? Now, a lot of our client organizations start here. So they have to grapple with that data quality issue. They're working on their data reliability. And so for many organizations, just to get to that reliable reporting historically, and for financial and operational purposes, that is already a significant first step. But then you'll want to move quickly from that into diagnostic, to say, okay, that's what happened. Now, why is it happening? And maybe you're looking at performance measurement here, performance improvement, or competitive analysis and benchmarking, or perhaps many of the organizations we work with are starting to look at real-time analytics and really figuring out how to monitor and the early warning indicators. So many organizations are probably in that diagnostic category. A handful, I'd say, moving into the predictive world. And so probably forecasting is one of the dominant areas here, and trend insights, but more and more we're seeing people foray into, I guess, what we call artificial intelligence, but is that machine learning piece, and really thinking about predictive models in a much broader sense. For us in MedInsight, we talk about our data science portal, but you'll have data scientists out there, right? And I'm sure you'll be tackling some of these newer opportunities. Ultimately, we do want to get to that final stage, which we call prescriptive analytics, and that's determining what actions are best. So that's where scenario analysis comes into play, but also I'll suggest to you small tests of change. So we'll talk a few times along this presentation about, really it comes from lean, and it's this idea of these small sprints. So they're adaptive. They deliver value early, and you can pivot as time and improvements come along. So let me pause there and see if we can launch our poll question. So which types of analytics are you using to inform your business decisions? And you can select more than one. Okay, Emma, Jen, do you want to reveal? All right, so I guess that is somewhat along what I was mentioning, that a lot of people do start off with that historical reporting and then the benchmarking and performance improvement. Quite a few doing some forecasting, and then some newer fields in real-time analytics, right? And pursuing that outcomes basis. So thank you so much, everybody. I really appreciate that. So if I can come back to this deck, do I have control? Oh, perfect. Thank you very much. All right. So one of the things to think about when you're taking on this challenge of data fluency, it's about making that information accessible. And you want to avoid the silos. So my example here is it's actually a large healthcare organization. This is a real example, but I'm not going to name them because it's not entirely positive here. So they chose, right? They chose to centralize their data analytics in a small hub. Sounds reasonable. Then you've got some very advanced data scientists and data analysts. But the problem was that then everybody's in a long queue. All right. And it's difficult to prioritize. So if there's a question from operations about staffing or supplies, does that take priority over a question from finance around value-based contracting? or vice versa? And where does clinical come in here if there's outreach or telehealth? So there were a lot of competing interests for the same tiny data analyst hub. So they said, okay, that's not working well. So why don't we got to have our own? So operations had their own analysts, and clinical got their own analysts, and finance got their own analysts. But then you've automatically set up these silos where you have back to that cartoon where different data sources and different approaches don't necessarily agree with each other. And we're in this endless loop of arguing about who's got the right numbers. So that's an example where we don't want to be. But what if you could really push out that data fluency throughout the organization? And I have an example of somebody who did this. They started out really reliant on us at MedInsight to do their annual reporting for them. And so a lot of their important cost reporting, even actuarial reporting, they came to us to do it. And then they had this little hub, as we saw before, where only very few analysts could do that. With our technology and training, they were able to push out and make into self-service these analytics for everyone. And with that, the focus changed. So the focus became more about engagement for them as to how are they connecting with their consumers. It became about tailored experience. What more can they do to address their high utilizers or their highest cost patients? What about the most vulnerable? What about disparities? So the equation changed for them. And of course, they no longer need us to do any of their reporting for them. They do it themselves. So I just, wanted to tell you that there's a great testimony to their success. They're a big employer organization out on the West Coast. But let me hand over to you, Will, to dive deeper.
Yeah, so I think, for me being an actuary, I always want to score these things up. And so a lot of our clients have asked us and we've helped them evaluate, so where are we really at? And so I wanted to go through a couple of examples and help you think about, so, okay, this center of excellence is made up of these different components. So let's just talk about data sets and say, okay, for sure, we have our enrollment and our medical claims and our pharmacy claims, but maybe we don't have good revenue information or capitation or good information around even the competitive market of rate filings and bringing all that together. And so we'd say, okay, maybe the organization is at a 6, and if we can specifically, let's get very objective around, if we can add these 10 other data sources, then we would be at a 10 in terms of data sets. So you want to think of some set categories and say, okay, where are we at 1 to 10, and what specifically do we need to do to get to a 10? Analytic tools, you might say, maybe the organization uses the Milliman HCG grouper to categorize claims and count utilization and do some comparative analysis. And you have a risk adjuster, but you're like, we really need to add in something, a Medicare repricer or a standardized unit price like our global RVUs, or a chronic condition grouper, something that helps do the analysis more smoothly. So you'd say, okay, well, right now, again, we're at a 7, but if we could add these other groupers or analytics to make it so that people aren't having to do ad hoc work, then that gets us to a 10. I'm not going to go through each of these, but just we're going to talk about the mix of talent. Melody's going to talk about who's there, and you could easily say, okay, if we can add these roles, then supporting the analytics, that's going to get us to a 10. But I think having some sort of scoring is helpful to see your progress over time and to be able to see that you are making progress and to see specifically where you need to invest to get where you really want to go. Clearly, training is a super important one to get to making sure that you have a foundational way that people can get basic training, get up and running and do simple things right away. But having available deeper dives into specific, how do I use the risk adjuster? How do I use these hospital contracting analytics? Get the tips and techniques shared across the organization so that people aren't fumbling and doing the same things over and over again. So hopefully you learn from these things. The telling stories with the data is super valuable. And again, there's easy ways to create some sort of objective scoring methodology. There's a little bit of subjectivity in there too, but hopefully that helps you think about how you would evaluate your current state, because now we're going to test you on that on the next slide here, Melody. Well, get you to score yourself on, so we've got a question on where do you feel like your organization is? And we've got these broader stage 1 through 5. So stage 1, analytically impaired. And so we're going to pull up a poll question here in a second, but or go ahead. Yeah, we can do that while I'm talking here. But stage 1, you really got data problems. Nobody's trusting the data, can't even get that working. Stage 2, maybe you've got some departments that do have good data and some analytics, but it's very disparate. Stage 3, there's a lot of different data. Each department has good data marts, but everything is not cohesive. There's not an enterprise solution. Stage 4, you have an enterprise solution. Everything is working across there, but it's still a lot of manual processes, and there's a risk of failure where one person leaves or one process gets interrupted. And stage 5, analytic leaders or mastery, where there's a cohesive analytical flow, where it's part of the culture, and Melody hit that up top, the culture of the organization, the leadership is supporting it, and that if somebody leaves, there's not a risk that others will, not step in and things will run smoothly. Hopefully that helps you get a sense of kind of the way we kind of have looked at the stages, and I'm really interested to see where everybody has placed themselves. Emma, do we have enough responses now, or do you want to give it a second?
Yeah, we're good. Hang on one sec.
Great. So most people, again, feeling like they've got good structure all the way throughout, and it's just a matter of getting that to work better together. Very interesting. Cool. Melody, next slide. So as an example there of kind of the way we've done things in MedInsight, and just to use this as an illustration. So if you look at the bottom left of this, talk about our data confidence model. And one of the things that we talk about in some of these other slides is just the need to automate things as much as possible and create standard reports that can be used over and over and over again. And so we've put a lot of energy into creating automated audits and data tests that tell us, when the data comes in, it can easily flag, bad data, good data, bad codes. But even more complicated audits of like, okay, the new data, for some reason, the risk scores don't seem to be working. So you've got to have some more sophisticated audits to tell you, oh, our risk adjuster, there seems to be some problem there, or hey, something happened with the birth dates of people because now the age gender factors aren't working. And so putting together kind of a very automated, quick process, tying to financials that, for our clients that give us the financials, and we do that reconciliation so they can, again, not have those arguments about the numbers, that this is how it ties out, is super important in creating that data layer and that underlying data layer that feeds up into on the top part of this graph. So regardless of our types of clients, so our clients at the higher end, in the same way in an organization, are going to have different departments that are going to view things differently, but the underlying data needs to be the same. And so for us, our provider clients see a different visual interface, and payers and self-funded employers and government. But the underlying data layer is the same there. And we're going to talk more about this in the next couple of slides too, and just like the need to make this very quick and nimble to have the data that meets all of those different needs in an integrated way. Otherwise, that's when, as Melody said, there's a risk of these different departments creating their own solutions, their own data marts. So we'll come back to that. Next slide.
Okay, so I'm going to continue this concept here. So thank you very much, Will. So as we look at this, the words that I want you to focus in on is the self-service manner. that I mentioned in the header there. So we were always trying to simplify, accelerate, and focus. So as you're looking at this, and I'll hark back to that complicated, organization that had the issues with the silos, it becomes difficult to do. And even when that organization tried to push out some reporting, well, that wasn't necessarily the question that the users needed to answer. So this idea of a self-service opportunity and self-service analytics. So at MedInsight, we give everybody access to the portal, and they can run their own queries and their own questions. They can check with us if they want help in optimizing that, but we're really empowering all of the users to do this for themselves. And I think that's very important. So hopefully you will have your own portals, your own data marts, and you're providing those analytic tools into everybody's hands. And it does make such a big difference to have certainly training for everybody, but also taking advantage of outsourcing to maybe it's industry leading third parties, so you don't have to create everything from scratch. One of the challenges that I've seen is the very frequent 10-year plans from each new CDO or CTO. Those are great, aspirational, but then again, there's a lot of change that happens during that time. And I've seen a lot more success when there are the smaller iterations really along this lean concept where you're recognizing value early and repeatedly. And that's been a very vital change, I think, in the way that we approach transformation. So here we see in the Analytics Center of Excellence, the importance of having subject matter experts, that access to a self-serve portal, education broadly for all, and then even that knowledge community where you can share your tips or share your challenges with each other. So moving on. So here's a bit of an example, right? So when you're thinking about pushing out continuing education. So we have quite a lot of organizations that happen to work with MedInsight on this. As example, on the payer side, there's lots, but I'll pick Highmark. On the provider side, again, many, but I don't know, maybe I could pick Memorial Hermann or even Medical Mutual. So we have a lot of different organizations that are doing this. Even in alliance with Epic, we're really trying to help people get an understanding of some of these offerings. And so what we're thinking about for objectives is really onboarding, upskilling, and then continuing education. So on the left, there is really my big message. But with that, you achieve that common language. So no longer are we debating numbers. We really can come to an agreed understanding because we really have a thorough depth of each analytic and each approach. We're adopting the analytics much more, no matter what type of analytics you're using out there. And we're building better industry awareness to tackle the real problems out there, right? The enormous challenges on the alternative payment side and risk management, right? And quality management. We're really trying to put the consumer in the center and having that first place. To do that, we've got to take care of all of these other things. So that industry awareness and learning from each other has been vital there. But let me move on. I wanted to share with you a little bit of an example. So your new users, maybe they're new to your organization or even new to healthcare, or they're growing in their role. They'll need to build that confidence, probably with the primers to start off with. So getting used to what we mean in industry, what we mean in the health claims data and all of the technical underpinnings there. But then pretty soon they'll want to move into technical certifications and get the deep dive. How does this analytic or methodology work? You know, what went into it? What are the caveats and nuances? And how do I use this in pragmatic real world examples? We might want to go into skills labs and classes. So I hope you're helping your folks get access to interactive coaching. So we can take a particular use case, you know, that you might raise and explore that in depth. And you're sharing information with each other as to how best to address this. And then finally, on the health analytics certifications, you'd be really trying to look at thought leadership there and appreciating what's going on in the field, what is the latest and greatest for concepts and case studies and pitfalls, and really getting an appreciation of some very challenging areas, whether we're thinking about social determinants or some more advanced risk management or the overall population health and accountable care. There is so much that's going on in our healthcare industry. And then this just happens to be an example of what we do at MedInsight. So we try to tailor it. So if you have the opportunity, I hope you'll be able to create really unique curriculum for each individual in your organization so that they are, of course, getting their initial implementation training on the technology, but then moving into what is most pertinent to them. So a financial manager may have financial courses, and so highlighted there. A care manager may have different courses that are more suitable for a clinical leader, and so on for a network manager or even a data scientist. So you could tailor your course selections for the role in question. Skills labs, it could be any of the following, whether we're thinking about site of care or waste analysis. There are many aspects that we would really want people to practice their skills and have the coaching support. And then ultimately certification. So you can see how well your own team is doing. So an individual basis, a team basis, or as an organization, and you can have a measure of how widespread data literacy is for you today. Let me hand back to you, Will.
Yeah, so our third question today, want to get your input on what's standing in the way of you becoming more data driven and more data fluent in your analytic flow here. And so we've got, so Emma, you can pull up the question here, but some choices here on, you know, is it a lack of time or budget? I guess we split them out on there, but or lack of skills, like do you need more training or hiring more skilled people? Do you not have the data, or do you not have enough use of the cloud, of the technology, or your server's not running fast enough, or is there a lack of strategic alignment and that leadership from the top? And I don't know, Emma, can we do the second question up at the same time, or do we have to close that one before we can? I've forgotten.
Yeah, sorry. It looks like one at a time from what I know.
Okay. So we'll take a look at that, and then we'll get to like, what are the specific things that would make it easier? So.
Steve, we've got Emma.
Cool. So time and budget, I always hear that one as kind of the biggest thing. Oh, we just don't have enough budget, don't have enough time. We're all busy doing whatever else. But it looks like the skills and is again that happens too. If people don't have the right skills to do the job, that is a big impact here. Technology and digital transformation is big, but I'm glad that so many people saw at the bottom the lack of strategic alignment being so important. And as Melody said, I think the culture and the leadership is really big.
I think that's huge. Hey, Will, notice that the lack of data isn't a problem for anybody. I just had to laugh at that because we're all inundated, right, with data, maybe even drowning in data. But I can tell you that try doing this in health equity.
Yeah.
Then you might want more data.
And so the right side of this slide was more like, what would make it easier? Like, are you looking for, and it kind of goes into those barriers of like, do you need more groupers or analytics that would help you do your job, whether it is faster processing of things, or is it the skilled people, the business interpretation, or is it the training? But like I say, I like that people are getting the organizational leadership commitment and having that show up, even just in decisions, conversations that are happening, is super important there. Next slide.
The next slide is mine, actually. So this is really to get us started about assembling the data team. So I'll kick us off, but please feel free to chime in. So these are some of the people that you might put onto a data team. So data engineers to start with, as we're structuring and cleansing that data scientists to really manipulate the data and take it to the next level for what you can mine from that. Data analysts is really on the problem solving side for addressing your needs. And then the data translators and data storytellers. That's actually a pretty new role in the market, but you might have heard a lot more about this role in just the last few years, that there is a gap. There's a gap between the thinking and approach of a typical data scientist or analyst and what a business user actually needs to translate it into the context of their real world. So this is a very important skill, and is really that storytelling skill. And by storytelling, all we mean is put it into the empathic needs of the situation of the customer and their question. So there's a lot of that going on. Knowledge experts, it could range. It could be somebody who is particularly knowledgeable on the community or equity, or it could be any of your clinical members, or deep dive into a financial question. So I put actuaries in this bucket, Will, for the knowledge experts. And then ultimately your business users and your executive leaders. And then on the far right, I popped out there, there's a value to having those external partners. So yeah, sometimes it's outsourcing for tech, but sometimes it's knowledge, right? And it's what they're seeing across a much wider geography or across many more organizations to bring you some of those best practices and tips. So my examples here, I think for that one I told you about with UCLA on JAMA, it looked a lot like this, these roles in particular. So everything that's on this slide. But what if there's not just this role? And as an example of other types, I'll put forward Virginia. So the Virginia Center of Health Innovation, and they've given me permission to mention them. They did a lot of work with their task force for the Commonwealth of Virginia, looking at primary care. So primary care and the total cost of care. And what they wanted to understand was, what are the patterns and what are the drivers? So where can we intervene to improve things? So their mix of the data team was this, and it was assembling and convening payers and providers and state representatives, so state leaders, and then the all-payer claims database, and there's employers in the mix, and there are consumers in the mix. So everybody was at the table, and I can tell you that changed our product, right? That changed the outputs. It made it richer. It had us thinking about, oh, what happens when a patient goes to urgent care and doesn't see their primary care physician? What happens as we balance that specialty visit need with a primary care need? So there were many, many layers that were revealed. And it was, I'll tell you a little bit more about them later on, but they will actually eventually tell you their own story. But for now, let me move on. I'll just hold that as a surprise.
Yeah, just thought this visual could be useful for you as you think about, this enterprise solution within your organization. And in the center, we start with the executive strategy, and we've been talking about that we need in the alignment and an overall focus that makes sense. But this enterprise solution has to make sense at each department too. And we've been talking about this, that if we don't do this well in each department, they will create their own solutions. And that happens in a lot of organizations. And so just want to make sure that you think about this and that there are specific focuses. I think for time, we won't go through each one here. I'd love to in a different venue, but you can think about what things mean in operations is very different from sales and marketing and the finance there. And if there are questions on this, please put them in the Q&A and we'll address them. Next. This is one, so I want to spend more time, and I know we have a limited amount of time, but the benefits. So when you think about the benefits of having this really well-functioning analytics center of excellence, the biggest thing that happens is efficiently using your team. So if you have, like, let's say you have a super talented person who can do everything, but unfortunately your structure is limited, and that person, you don't have people hired out. And so that person is doing data entry, they're cranking out some monthly reports, but they really should be the data scientist figuring out new innovative things and helping do those things. That is inefficient use. Or if you have a lower end data analyst who is trying to architect out what you should be doing or doing some data science, and they just don't have the skills to do that, that means you're not getting this right. But if you have everything working right, you'll efficiently use your team, which is great for your productivity, but it also creates this flywheel of creating happier, less frustrated employees. Most people really want to be doing, they want to be doing the stuff that they're not good at and that there is below or above where their really skills are. And so creating those happier, less frustrated employees leads into them being able to get the job done quicker, more efficiently, and then you'll get better decisions. You'll have better data, improve business outcomes. And those kind of lead back into people be able to specialize in the division of labor and focus on what they're really good at. And it creates this flywheel of success and keep improving, and it makes it run faster and faster. And it doesn't feel like it's fast because everybody is comfortable working their part of that loop. Next slide. So another kind of illustration of the benefits in action, and hopefully this will resonate for you. It seems like there are a lot of people in that level 3. And so hopefully you're getting this type of analysis done pretty quickly, but this is modified from a real example. Client, the CEOs want to know, well, why do we have a 10% trend for AC individual business, but only 5% for group? And your analyst should be able to go in there, and in this case, they were able to quickly go in there and not have arguments on the 2 million, 1 million, but be able to say, okay, the base PMPM, current and prior, we can agree on that. We can agree on the 10% and the 5%. Those trends are real. And then we can quickly dig down and evaluate what are the changes in membership? Is there big differences in age and sex or morbidity across the two populations? Are there big changes? Is it utilization or is it unit price that is driving these trends? Are there changes in service types? Is it inpatient? Is it outpatient? Is it pharmacy or chronic conditions? Do we have more cancers or more diabetics, or the cost per diabetic? And so those types of reports should be very easy and in a well-functioning analytics center of excellence. And in this case, for this client, they were able to do that really well. And they essentially drilled it down, and it was hospital unit price trends were 20% for ACA, 3.6% for group. No real differences in the other drivers. There's always some noise there, but they were able to pull that down and say, okay, this is a nice clean summary. And the analyst then is able to show the results by hospital and say, okay, how do we compare ACA versus group? And one of the things that came out there is they did this on a percent Medicare basis, so that they weren't necessarily thinking up top, but kind of knew in the background. But the ACA unit prices were about 150% of Medicare, and the group was around 200% of Medicare, so 25% or so below. And but that gap was narrowing. So part of this trend increase was narrowing that gap, and that there was essentially a lot of pressure from the hospital systems in this case to make the unit prices approach more of the group from that ACA side. But again, your data analyst is able to do that pretty quickly, look at what percent Medicare is across those. That's already been run, that grouper, that data layer. It's just a group by and sum query, and we can drill down on that. Is it inpatient or is it outpatient? But in the end, it turns into, okay, the contracting with the hospitals is a problem here. And so one of the things then Malik was also able to do in this analyst generic, this is just a de-identified name here, but the analyst was able to go in and look at their rate filing competitive information and show that their competitors were not increasing their rates as much. And so this really was disadvantaging their competitive position. That it wasn't like, well, everybody is doing this, so we're in the same place. And so they really had more strategic engagement, CEO still involved and wanting to get the provider network really engaging on what can we do to get the right resources to our hospital contracting to create better outcomes. And in the end, they really had more of a different pivot, not just getting, better data for better hospital negotiations, but saying, we really want to do more value-based contracts for ACA and total medical loss ratio, getting the risk scores in there, doing it more like a Medicare Advantage structure, but kind of all of that leading from a pretty clean data process because they had a really great data layer and analysts to run that process. Again, love to, if there are questions, we can dig into that some more. Next slide.
Okay. We have got so many of these kinds of stories, right? And we can obviously go into lots of depth on each one. So I totally respect that we don't have a lot of time. Here are just a few examples. So we've got a catalog. I had a look. There's more than 500 case study examples to choose from. But here are a few along these themes. So affordability, cost drivers, risk, care management, and optimizing wellness. On the affordability side, I could pick anything. So Will, you just talked about GRVUs and Medicare, but I'll talk about waste a bit. There are a lot of our customer organizations that really take that deep look at low value care. So 58 measures of low value care are available in products today. And so it's important for quality of care for that patient, and is not in fact just only a cost equation. Will, I don't know if you want to pick one of these.
Yeah, I was going to actually so we had a pretty recent client forum presentation from Blue Cross of Kansas City, where they used our, in combination with their MedInsight and the consulting there of creating kind of a Medicare base fee schedule, evaluating the percent Medicare of their different hospitals and identifying outliers. And so they were able to present out how they were able to use that to go in and renegotiate a couple high cost contracts and create some significant ROIs in just having a cleaner way to case mix adjust and show the unit price relativities and then change their base contracting structure.
And I'm so glad you mentioned the forum. Well, so on the far right, there's actually the Virginia example in the middle there, where it says identify primary care and this outcomes and leakage. So they're one of the many groups who are going to be speaking at our client forum that's coming up really soon at the end of October. So it's a chance for lots of these organizations to showcase their successes, and they're talking and presenting what they have done and achieved. So I definitely won't steal the thunder from Virginia, but if you want to know more, then, please, you're all welcome.
Well, I promised to stay on track on time, and yet we're here at 5 minutes left. So I know we want to get to some questions too. So I'm gonna go through this pretty quickly, but I certainly would love to spend more time. I wanted to just give you a few warnings of things that we've seen other clients run into is, don't try to create this awesome, amazing solution that takes years to do. Make sure it answer some questions right away, and don't make it so complicated that nobody knows how to use it. Make sure you really train people well, and hopefully this fits with some of the other things we've already been talking about today. Don't let the arguments argue about which data is correct. Make sure there's clear reconciliation of your financials, foundational data, so that those arguments can be nipped in the bud. I know there was one of the comments like just trust the actuaries in there, and it's like, well, you don't want to just trust anybody. Everybody should agree to the same thing. But the talent and resource and authority on that team, they have to be getting the job done quickly, or if you can't add dimensions and metrics into the central enterprise solution, each department will go on their own and they'll create their own solution, and you'll have divergences there. And if they can't get results out quickly of the central solution, again, the departments will do that. And so all of this really comes down to, leadership needs to support and drive everybody to the single source of truth. You need to shut down those department-specific data marts, but they have to make sure those needs are being met. Let's hit the last slide, Melody, and try to hit a couple
questions. It's just a summary slide. So, this is everything that you've heard about for that well-honed analytic strategy. So talent and training and getting the right tools, but also, Will, as you said, about scoring and setting goals for measuring progress, and then storytelling and this idea of the strategic balance of resources. So I want to stop there, right? We hopefully can take a few questions.
And I know it would be great if you guys have a few extra minutes. I know we're supposed to end in 3 minutes, but maybe we can get through a couple of these questions quickly. And if folks can't hang on, we will be sending out the webinar link later, so you can always listen for these later on. So we've got a great one from Michael Bortowski here. From an insurance payer perspective, what advantage does real-time analytics have over day-old data? And what would be gleaned or adjusted hour to hour versus knowing the next morning?
I think it depends on what you mean by for real time. So you're right. There is that type of real time where it is a minute to minute kind of transaction. But sometimes, if we're looking at claims data, real time for us just means, very near. Real time is not what happened this hour, but is what happened within the last month. And so, we're just seeing the shift in patterns quite frequently, and it is far more than what we've received historically. So it used to be we have to wait a long time for all of that data to come in and for us to get a good understanding. So now we can do a lot more of that closer to real-time analytics on claims. We can also integrate more truly real-time data as we're integrating with other data sources. So we get an understanding of what's happening to the patient and what their needs are, hopefully before, during, and after that encounter.
Thanks,
Bella, what do you want to add?
No, and for time, we'll keep going, but I agree that sometimes monthly is effectively real time. So I think the question was, do we really need stuff every minute, every day? No.
Yeah, so Will, great question for you. You mentioned that payers and providers are working with the same underlying data. So how can providers account for info asymmetry when that is not the case due to redaction of allowed and or paid amounts?
Yeah, so this is a topic right here that we could spend a lot of time on. So what I was talking about was in our MedInsight environment, we're creating the same we have the same basic data structure that can be used to support payers or providers with whatever data comes in. And in the same way within an organization, and I was trying to use it as just an illustration that within a payer organization, you want to have one data layer that you use to support your network analytics, your medical management and your sales, and that those are going to cross over and create some synergies there. So I agree there are disconnects going on right now. I do think with transparency, I've been spending a lot of time in transparency and that coming out on 7/1. I think the biggest secrets in healthcare are coming out, and I see more providers able to push to have that information now shown. So they don't get the data redacted and they're able to see the unit prices because it's all no longer secret. So hopefully that's changing, but that has been a problem. I agree.
Great. And one last question, guys. Thanks for hanging in there with us. With self-service, how do you ensure analytic rigor? Do you control for relevant factors before someone runs some analysis and makes some decision or public statement? It's a tricky one, Melody.
Yeah. And I'll take a first pass at this, that I think this is where Milliman, we've been one of the pioneers on our consulting side in particular, but also on the MedInsight side on peer review. I think peer review is really important, that you get two qualified professionals reviewing things. I think the training is really important on that, because I agree, you can have an analyst go in there and show, $1 billion PMPMs and something, and you're like, okay, well, clearly we know that's wrong, but they didn't know it was wrong. And then they run with it, and things can go out of control there. So having a peer review process and a way to get subject matter experts who can help do that peer review, having a really good documentation of here's how the query and the structures were done to get to this result, and having somebody be able to step in and do that, I think is, for me, pretty important. Melody, anything you want to add on that?
I agree with that. So the comments on self-service are really to enable those quick questions to get answered, but the peer review process is crucial. And so hopefully it's not just a single person who's looking at that and making a decision, but they're using that information to start up a dialogue with others, get some cross-functional input, I hope, right? So then if other people want to look at other aspects of that same question, right, they also have immediate access to the data, or even if you wanted an outside party to share what they know. So there's more and more folks that are more easily involved in this decision, right? So it should be a stronger and more, better rigor.
Well, I really just want to thank both of you for joining us today. This has been just chock full of information, and I know there's been a lot of questions and interest. So thank you. I hope you'll come back and join us again, Melody and Will. Really appreciate the presentation today. And again, we'll be sending out all the information. Melody and Will, if you want to put your emails or contact information in the chat box so people can get in touch with you, that would be great. I'm sure there's a lot more interest in terms of reaching out to you. So thank you for joining us today, and thanks everyone for being online. Have a wonderful afternoon.
Have a great day. See you.